Hospice, the clinical diagnosis is a terminal illness that the doctor foresees lasting 6 months or less. Now, hospice, when you come on board with a hospice organization like us, it's more, it's not really a word, it's not really a term, it's not even really a type of nursing, it's more of a care. It's a whole new world, and it's geared only towards a patient. Of course, their caregivers and their families are involved, but it's patient driven totally. It's what makes a patient comfortable, what makes a patient happy. We endeavor to do everything that will make them happy and comfortable with the rest of their life. Most of the time, we deal with the patients. You always try to deal with the patient. Mm-hmm. So they're your first focus. Mm-hmm. Then the family, of course, comes next because they can answer the questions if the patient cannot. They're as much involved in the hospice care as the patient is. It's just that the patient is the one that, is a primary focus. And it depends. For some patients, hospice patients, they may not have any pain and they may still be doing their day-to-day activities, and that's great. We'll just provide if they need any assistive devices or anything to help them stay comfortable. We take care of that. If they, once they do start, entering the phase where perhaps they are in pain and they're uncomfortable, then we take care of that. We want to make sure that they have any emotional support they need. So the hospice team, it involves a chaplain, it involves a social worker, it involves an aide. So all of these, we're all team players and we all work together. So it's not just a nurse comes in, looks at you, goes, yeah, you need something, walks out the door. It's never that way. If they need pain medications, they will certainly get them. So it's all about keeping them comfortable as far as that goes. I believe that when you go in and you assess the patient, the first things that you look at is you want to see what stage the patient's at as well. Not only mentally, not only physically, but mentally. Because it can be a tough situation. So that's probably the main thing. And then, of course, you want to make sure that they are comfortable, that they have everything they need. Then you need, of course, focus on the family. Make sure there is family or a caregiver of some sort. You always want to make sure that somebody has somebody. Everybody needs somebody. If you need to interview a couple, do it. Go by recommendation, go by word of mouth. Maybe so-and-so knows somebody. We can certainly give references if that's necessary. But when we come into your home and we focus on you and we spend the time and we sit down and we more than once I've had patients, families say, hey, you're a part of the family now. You come on in, you sit here. And we're trying to stay out of the way, and they're like, no, indeed, you come on in, you're part of the family. And that's, that your message has gotten across. That's the best thing to hear, because the patient's happy, the family's happy, the patient's comfortable. You see the patients, you learn to read them. If you go in, and I go in a week later, and even if you tell me I'm fine, I don't need anything, I can tell by looking at you that maybe we need to talk. I think something's going on. Let's see if we can figure this out. So, you need to be on top. You need to have that, that sixth sense going. And you get it. You get it if you take the time with the patient and really listen to them. And hospice is more, it's a passion. It's more of a way of life. A lot of people say, oh, I can never do that. I can't do that. I can't do that. But yet they are able to go take care of their, maybe their grandmother is dying and they find that they really can sit by the bedside, hold her hand and talk to her. It's peaceful. You want it calm and you want it peaceful, and you don't want any pain. You try not to alleviate that as much as possible. And so the hospice is more of a, I don't want to say a calling because that sounds so cliche, but it is. It's a type of passion. You feel it. It's more in you than, you get your nursing basics down pat, and then the other part, I don't want to say you either got it or you don't, but you kind of do. And a lot of patients, frequency is a big thing. You need to see these patients. You can't just go into a patient's home, like I said, and be there for 10 or 15 minutes and really expect to accomplish what you or the patient needs. So you need to be able to sit down and really, really talk to the patient. And if you're there for an hour and they're still talking, wonderful, you sit right there. I think it's important to take that time to build the rapport.